just mentioned it in some committees that we see an opening, we think a softening, and we see if the facts are out there, what this is really all about. I think there's some of our members that may not understand the full impact of the expansion of Medicaid.
We've had several conversations with Governor Haslam.
So Haslam asked you to put your bill in those?
I didn't say that.
Well, let me tell you what's important to me. I live in a small community and I represent a rural area. I got a hospital that employs about 100 people. So not only am I going to lose a hospital, I'll lose 100 jobs in a county with 24,000 people. I'm 30 minutes away from the main hospital, which could mean life or death if someone got sick. That's what it means to me. What it really means to me is getting the legislation passed one way or the other. You know, so I don't think this is a political game. I think it's about me going back home telling the people I represent that we're going to do something about their welfare. That's what it means to me.
This is the only bill filed in the General Assembly that I'm aware of that would compel expansion of Medicaid. We've been patient with the administration to make that decision. But if we continue to wait, we will lose our opportunity to be able to present this point, just as Representative Turner said, because the committees will be closing. So this is a timely action, not done in haste. This is not the first week of session. This is right at the first week of March. We are 6 weeks from going home. So the time to address the issue is now. And so I appreciate our leaders here going forward and doing that. And I would say this to you, ladies and gentlemen. I don't see how a legislator can put in their brochure that they are pro-life if they are going to turn their back on the lives of 300,000 Tennesseans on a life and death issue of health care.
And we don't think that, we don't care who passes the bill. We just want to see it get done. And I think that this is part of our job here is to inform constituents through the media's help on what the consequences are of passage of this bill or non-passage of this bill. And I think, I'm not sure a lot of those people in rural areas and some of the urban areas understand the implications on their hospitals and the dire effect that the non-passage would have on their communities. And part of this is us getting the word out and let them know that.
Senator Finney, if